The new Republican-led Congress is back in session, and it is clear the first order of business will be to dismantle President Obama's signature health care law, the Affordable Care Act.
Meanwhile, Democrats are digging in, vowing to oppose this repeal effort. President Obama huddled with Democrats on Capitol Hill today to try and save Obamacare.
Betsy McCaughey, former lieutenant governor of New York and conservative health policy expert, joins us now on set. Happy New Year to you.
Happy New Year.
Good to see you. All right, so Nancy Pelosi and Senator Chuck Schumer came out earlier and spoke after their meeting with President Obama on the Hill. I want to play a little bit of what they had to say.
Republicans are plotting and soon will be executing a full-scale assault on the three pillars that support the American health care system: the Affordable Care Act, Medicare, and Medicaid. The Republican plan to cut health care wouldn't make America great again. It would make America sick again and lead to chaos instead of affordable care.
They have no replacement plan. They have no replacement plan because they can't agree. They don't have the votes for a replacement plan. So to repeal and then delay is an act of cowardice. That means we don't really know what we're doing.
All right. So, Lieutenant Governor, the vice president-elect was also on the Hill today.
Yes.
He said that on day one, the president-elect will sign in order to get rid of Obamacare, the Affordable Care Act. But there are a lot of people that are saying there are no specifics involved in what the Republicans want to replace it with. What's your response to that?
Well, actually, the Republicans have been working for a very long time, and they have several concrete plans which agree on almost everything. There are a few fine points, a few places where they're still working out details, but the fact is the Republicans have listened to the American people. The American people don't want the Affordable Care Act, but they do want good health care. They want coverage for people with pre-existing conditions. They want the uninsured to be covered, and God knows there is nobody in America who wants to take health care away from the elderly. So when I hear Chuck Schumer say this is going to be an assault on Medicare, you read my piece on Medicare in the newspaper this morning. You know how much I care about Medicare. I would never support an effort to assault Medicare, or for that matter, to diminish the quality of Medicaid. We need to improve it. So let me say this. The Democrats will again and again insist that the Affordable Care Act
Which you're holding
working.
there. You are
That's
holding
right.
the binder
I know this
of
law
the federal
well,
law.
and the implications of it. And the fact is it isn't working. Premiums have doubled since this law went into effect. Doubled since the first Obamacare plans were offered.
Betsy, that's one of the criticisms, though, is that Republicans say it's too expensive and they want to bring down the premiums. Donald Trump has even said that the deductibles are very high. He wants to do something with that.
So
but I want to ask you, at some point, something's got to go. So what is it? Is it mental health? Is it birth control?
What's the method?
Let
me. I'll get to that in a second. So when the Democrats say it's not working, look at the premiums. More than that, look at the lack of choice. In a third of counties in the United States, there's only one insurer left. The insurance companies have said this law is not working, and they have headed for the exits, depriving the American people of choice. And then when you look at the...
So what will you cut, Betsy? You've got to cut something to be able to save.
It's a matter of how to pay. Let me give you an example. This law requires that insurance companies sell health plans to very sick people with pre-existing conditions, and healthy people for the same price. Now, of course, that sounds great, and everybody wants people with pre-existing conditions to be covered. But 5% of the people in this country need 50% of the health care. Those 5% who, sadly, not through any fault of their own, are sick, consume 10 times as much health care as the ordinary person. So if you have 10 ordinary people in a health care pool, and you add one person with pre-existing conditions, the premiums for those 10 people double right away.
But that's a criticism that
There's
Democrats have.
another way
How do you
to
deal
do
with
it.
that?
There's another way to do it. And in fact, I've been working on this part of it for a long time. Instead of foisting the cost of the sick on the very small number of people struggling to buy insurance in the individual market, all taxpayers should help out with that. We should have high-risk pools in every state, fully funded, so that when someone develops cancer or Parkinson's or any serious illness, their insurance is covered. The average cost will be about $38,000 per person, covered by taxpayers. Right now, you're asking the 30-year-old man who's struggling to pay a mortgage or buy a car to pay a premium that's double what he should be paying to cover the cost of someone who's sadly sick. It's not fair to put the whole burden on that one person.
So, Lieutenant Governor, let me ask you this. First of all, two of the biggest hospital trade groups sent a letter to the president-elect and to members of Congress, and I want to read from what they said. An unprecedented public health crisis if you do away with the Affordable Care Act. They went on to say that hospitals stood to lose $165 billion, that 20 million people would lose the insurance that they gained under the ACA, and they predicted widespread layoffs, patients without any health care. Kellyanne Conway herself has said that it could take years to replace this.
I want to answer this because I don't want anyone to worry like that. The fact is, there are 20 million people newly covered. 16 million of the 20 million are on Medicaid, the public program for low-income people. It's been around since 1965, and it is not going anywhere.
The Republicans do not want to touch Medicaid.
They are not going to revoke Medicaid. They do want to block grant the funding to the states because right now we see Medicaid per capita spending increasing twice as fast as Medicare, and there's no evidence for all that money. The health status, the blood pressure, the diabetes control of people on Medicaid is improving. We want better health care for the dollar. So that will be block granted. That's in every one of the plans.
We're going to have to leave it there, Betsy. I apologize. I want to thank you, though, so much for your time. Betsy McCaughey, thanks for joining us.